About 15 years ago, the school embarked on an effort to try to create scholarships for our students. And to date, we have more than 20 named scholarships for more than 30 students every year, most of whom are in this room, and congratulations to all of you. Now, this was actually, for some of you who've been around a long time, like Mike and David, Bill Bridgers, who was the founding dean of the school, had a dream that he wanted to have enough endowments and scholarships so that every student that went to the UAB School of Public Health would go for free, which is a fabulous dream. Clearly we're not, oh, wait a second. Clearly we're not quite there yet, but I think it's fair to say that all of us believe in the importance of the students, believe in financial support, and really are looking forward to try to expand the number of named scholarships that we have so that we can support as many students as possible. So for those of you that have been donors or those of you that want to be donors, just remember this opportunity for the named scholarships.
I always look forward to this luncheon because we get to recognize two very special groups of people: our scholarship recipients and our generous donors, who in some cases are the reason why a student can pursue an education in public health at UAB. I've been at UAB for almost 15 years, and I can truly say that it is always an exciting place to be. But as we look to the future, it seems to be more exciting than ever. Last month, Dr. Ray Watts, a UAB alumnus, was named the 7th president of UAB. Throughout his career, Dr. Watts has demonstrated visionary leadership in education, research, and clinical care, and I believe, as our president, he will continue to position UAB as one of the great universities for the 21st century. And as UAB continues to serve the people of our city and state and region, the School of Public Health will continue to play a central role. Public health is concerned with protecting the health of entire populations, and whether it's a local neighborhood or an entire nation, research and work being done in our School of Public Health is making a difference. To the parents here today, thank you for allowing UAB and the School of Public Health to be a part of shaping your child's future. And to our donors, we can never thank you enough for having the passion and foresight to invest in the students that are here with you today, students who will become the next generation of public health leaders. Thank you.
I want to start out by, again, thanking Dean Michael and all the faculty here at the School of Public Health for recognizing me today with this award as the Alumna of the Year. I'm very honored. I'm not really sure that I'm deserving, but I'll accept it graciously and say thank you for recognizing me. I also want to thank a few folks from Alacare and from my family that are here with me. My daughters who are in school today at John Carroll were not able to attend, but my dear husband David is with me, who has put up with my long work hours and my career in public health over the past 25 years. And my brother John, who is also my partner at Alacare and the president of Alacare, who has been helping me and working directly with me since 1988 when I joined the family business. When I think back about deciding to come to UAB, to School of Public Health, I'm really grateful I made that decision. I had the opportunity to go to several different schools of public health, but I chose UAB, one, because my family was here, and this guy sitting in the audience was my boyfriend at the time, and I didn't want to leave. But it was a good decision on my part, and at that time, Dean Bridgers was the dean here, and one of the very first things he did for us when we started was he had this big welcoming party at his house. And I don't know if Dean Michael does that for y'all, but if he doesn't, y'all need to get that going, because that was a great mixer. I'm sorry. It was a great mixer. It was a way we all got to meet each other, the students and the faculty and everybody that worked for the school, and it was a lot of fun. And Dean Bridgers was just a great guy. He was just a wonderful man, and I learned a lot from him while I was in the school. But Dr. Waterbore, who's in the office, I'm always thinking about the office, in the audience was very instrumental for me. When I first came to the School of Public Health, he was my academic advisor. And I'll never forget, I was kind of, still pretty young and everything, and I went into his office and I said, I think I want to be in epidemiology. And he looked at my papers, he looked at me, he looked at my papers, he very nicely said, Susan, I've looked at your math scores. EPI's not for you. You're not going to be, I just don't think it's going to happen for you, but we have a lot of schools at Public Health, and I'm sure we're going to find the right one for you. And so I started taking classes, and lo and behold, Dr. Waterbour was right on the money, because I sort of found my niche in the School of Public Policy and Organization. I don't know if y'all still use the same tracks that we had back then, but that was what my track was, Organization and Policy. And shortly after that, I think within a few months, they had begun a joint program with the MBA school, and Dr. Michael Morrissey was teaching a class that I had, and I remember he suggested that I look into that joint program, and that's when I think I really kind of found my niche in the School of Public Health. As I finished up my joint program with the School of Public Health and the School of Business, I went to work in my family business, Alacare Home Health and Hospice, and needless to say, I've been there for going on 25 years, and we've had a really exciting time. I did public health. You can think about all sorts of different areas of public health, and as you go through your career and at school, as you're thinking about it for the students especially, broaden your horizon and think about lots of different things you can do with a degree in public health. And home health and hospice is probably a little outside of the mainstream of what some people think public health might be, but it really has been my area where I've been able to use my public health education to give back and do something meaningful in the world. And I've had so many opportunities because I came into the business at a time when it was really still quite small. It was a very small little industry in 1988, and it's still a small industry, but it's a very rapidly growing industry. My father, the late Major Charles D. Beard Jr., started Alacare, and I think at the time that he started the company, it was a passion for him. It wasn't what he did for a living. He was a pilot in the Air Force. Then he retired. He came back to Birmingham. He saw a need in the community for more home health care services. He had a personal experience because he had a lot of elderly family members, and he saw them, needing services and not being able to get care. A lot of them lived in rural areas of the state, and he started just out of a passion that he had in his heart. He started our business, and he's truly a hero to me. And I think he's also a public hero in the state of Alabama because he was one of the first individuals to start a home health and later a hospice organization. So I'm very proud of that history for our company. And today, I think my dad would be very proud. Since starting the business in 1970, when I joined the business in '88, we had 100 patients on service. And today, this past year, I'm proud to say that we cared for over 20,000 Alabamians across the state. And so I think that's a pretty good public health mission, and something that we're carrying on and will continue to carry on. So I want to thank the School of Public Health again, thank the dean, thank the faculty, congratulate all of you and your parents for the scholarships that you've been awarded, and tell you you've made a great choice to come to the UAB School of Public Health, and wish you all the best. Thank you very much.
Growing up here in Birmingham, and I also teach math. As I have a bachelor's in math and aeronautical science, and I asked Fee, who told me about coming, inviting me to speak, and I said, well, what am I supposed to say? And my mind said, well, just thank them for their money and leave, but one of the first lectures I give as a math teacher is I always ask my students, why are y'all taking math? And 90% of them say, because we want to know how to count our money. And then I go on to talk about what is money. We talk about the central bank, the Federal Reserve, and come to find out it's really just guaranteed, paper by the 12 reserve banks. And, they leave the lecture, and one of my students said, so you're trying to say it's not about money, it's what you do with it. And I said, you got it. you probably will pass the course, you know. And I think that's what this is about, is it's not just thanking you for your support and from financially, but also, you know, I realize in doing public health is, as Alacare, you know, I work at St. Vincent's Health, and at St. Vincent's, I work on the behavioral health, and, you know, a lot of my colleagues said, we think you need a bed here because now you're going to getting a bachelor's, master's, and doctorate. Now you're going to get an MDiv. You know, you might want to get a bed here on our unit. But one of the things we always talk about is how public health impacts so many people in its ministry. And, you know, and when it really comes to thanking people, you know, I really want to thank a lot of people for their financial support, but also the School of Public Health for showing kind of this idea of method. You know, how to go about life. You know, a lot of times growing up, I always tried to get it right. You know, in taking classes, somebody mentioned Dr. Waterboard and Epi, you know, trying to get it right and always trying to get the A. And in graduate school, the grades sometimes don't matter as much as the knowledge. And so not only do we, am I grateful today as a student to have the financial support of being the inaugural scholar of the Billy Cox Scholarship, but also for the School of Public Health and for my matriculation, for showing me that some of the methodology, you know, that life is not always about getting it right. Sometimes it's figuring it out. Sometimes it's messing up and going back over and doing it again, you know. And the last thing I'm very grateful for is for the memories. And Susan kind of alluded to that and talked about it, but I'm more convinced, you know, my mom passed in November of 27th of breast cancer. And my passion has always been, Susan talked about, we have to find that HIV/AIDS, which some sort, you know, in our country is still kind of stigmatized today. But in the work that we do as public health scientists and public health activists, diabetes, you know, obesity, all those things, you know, it's really about the day-to-day moments that a lot of times we take for granted, you know, and being a student here at the School of Public Health has really taught me how to live one moment at a time, one day at a time, you know, and writing my dissertation, one revision at a time. and really understanding that all we really get to take with us, not the money, it's not the methods, but we really get the memories. And I'm very, very grateful to be with you all today on this date at this time and making this memory. And I look forward to taking pictures to commemorate this and really thank you all for taking time out your day to be with us here today. So thank you all.